Every facelift, in my opinion, is different because it's like a painting created by the artist. We try to create results that are very natural, and that's why the name Naturale. Generally, people who have got the middle part of their face that is sagging down, they have jowls that are coming up across here, those who have loose skin across there, are typical candidates for a natural face and a neck lift, because generally a facelift always includes something worked on the neck. The natural facelift is unique, and people think that because vast majority of them are done under local anesthetic, that it is a smaller procedure, it's a weekend lift or a lifestyle lift. That's not the case. The way I do it is a technique that allows us to have a facelift that lasts long. Underneath our face is a layer called the SMAS, S-M-A-S, and that layer is a fascia that over time relaxes. It takes along with it the fat pads, and everything slowly starts dragging down. Typically you see that in your neck, typically you see that across here. And we do make an incision across here, but that allows me to take the inner border of the muscle across over here called the platysma, and we tighten it up. We tighten up such that you get a nice angle across here. There is nothing below the jawline that you can see from the front. That makes the face shorter and more youthful. Once that repair is done, multiple studies have shown that that area does not become lax again. You may have some loose skin coming up, but once the muscle is tightened up, it stays like that for a prolonged 20, 30 years. And so therefore your results in your neck will last for a long time. We do around 40 or 50 of these every year, and over time, we have determined what works best as far as keeping it very comfortable. So typically we'll give a patient some Xanax, some pain medication, antibiotics hour and a half before they come to the office. And we warm the local anesthetic solution to a body temperature mixed with sodium bicarb, inject it very gently. In 3 minutes to 5 minutes, the entire face is numb, and the entire procedure is then painless. I prepare my patients for it. I explain how I'm going to do it. I talk to them while I'm injecting, and they never have a complaint even once that this was too much for me. The natural facelift that we do is typically done in the office, and the reason why I do it under local anesthetic is because I've seen in my own practice, when I've taken a patient to a surgery center, when we typically put a person to sleep, then the recovery time is significantly longer. Of course, once you put a person in anesthesia, the other issues that come up, costs rise, there is more nausea, blood pressure rises up and down. Many times patient could have other issues with breathing, or sometimes the blood clots in their legs. And by doing a local anesthetic, it completely circumvents all those possible complications. Typically after surgery is done, you would be able to go home immediately. We like you to rest on the recliner, put some ice on the face. There is one drain kept inside there that stays for around 3 to 5 days. It reduces the bruising in the neck. The drain comes out very easily. You can wash your hair, and that's about it. There is a kind of a neck strap or a face band that's kept for around 5 to 7 days. That helps to keep the swelling down. Typically, I'll see the patient the next day, so I can check everything is okay. All the stitching is underneath the skin, and therefore no stitches need to come out. We place scars or incisions in lines that make it very difficult to be seen. It does take time, and I tell my patients, you will see a red line where I have made the incision, but generally after around 6 months to a year, most patients are extremely happy and they'll put their hair up. We hide the scars very well so that others may not know. It's very fearful for a patient who comes in for a facelift because it's the alteration or change, definitely for the better, but still a change. You can hide different parts of your body, but you cannot hide your face. And I think the single most important worry that patients have before they agree to a facelift is that fear that what if others see me as somebody who's had a facelift done? What if my nostrils are wide, my face appears very tight? Many people are worried that if I go out, people will not recognize me. So my job is to create the same person looking 15, 20 years younger. I would like the patient to be asked questions like, have you lost weight? You look very refreshed. What's going on in your life? I want to share that too. Rather than say, so you had your facelift done, who did it? That's not the question I expect to be asked to my patients. And I tell my patients that as I look back at my results in the past, which means like an artist looking at his paintings in the past, what is his style? I don't see any of my patients ever complaining, nor do I see any results that makes them feel like my face changed dramatically or my friends would walk past me because it was not me. And I think it is that single important factor that we try to obtain as our primary goal in doing the Naturale Facelift.